Hi, everybody who is just tuning in. My name is Amanda Fazzalari, and I am a former Saba University School of Medicine graduate, and I'm currently a general surgery resident at St. Mary's Hospital in Waterbury, Connecticut. And I'm here to go live tonight to answer some of your questions about Saba and tell you a little bit about my journey going to Saba and tell you a little bit about where I am now. So I think that if you ask questions, I will be able to see them and I can answer them as we go. And if I don't have a chance to do that as we go, I'll try and answer them at the end. So my initial decision to go to Saba was influenced by a cousin of my aunt who had been to Saba and graduated and was a current practicing family doc at the time. And he had wonderful experiences at Saba, and not having any real doctors in my family and not knowing anyone that had really gone to medical school, and certainly not to an international school prior to that, I was very intrigued. And so when I was doing my research, I looked into schools in the Caribbean as well as in Ireland and in Australia, and ultimately I decided to attend Saba because the Canadian match rate was so good, and the rotations that they had across the U.S. Were appealing to me. So that was how I ultimately made my decision. I also the small class sizes appealed to me. That was something that I thought would be a big advantage, and I was happy to be in a school with a small class size. My experience in basic sciences was wonderful, even if maybe at the time it just felt like it was really tough. Looking back, it was definitely some of the best times of my adult life so far. The classes, the academic curriculum was very rigorous, with classes every day of the week from 8 to 3 or 4 in the evening. So you really didn't have time to fall behind with lectures every day, and exams every 3 weeks. So that being said, though, being in a group where everyone's kind of going through it together and having that competitive environment around you really pushed me, and I know a lot of other people, to succeed because you just didn't, there was just no looking back. You just had to keep working, and everyone around you was working really hard. So that environment was really fantastic. That being said, after the exams every 3 weeks, my classmates and I always found ways to really celebrate and unwind before the next block would start. And, so a lot of the other islands are very close. So you can take a short plane ride back to St. Martin for a weekend, or another island, and do a lot of hiking and just relax. So we had a lot of fun on our time off, and that was really a time where the friendships that you develop are just so strong because you go through so much together. And I was really fortunate to make some really amazing friends that are some of my best friends, and we still talk every day. We are in different parts of the country. Some are in Canada, some are in the U.S., and we text every day, and we're in different residency programs now, but we're still the best of friends. So that was wonderful. As far as the classes, I mentioned kind of having a small class size is really helpful, or it was for me at least, and I thought that I could always gain something from class. Medical school is a lot of independent learning, and that doesn't really stop after you're done medical school. You're always having to study and figure out ways for you to learn things based on your learning habits and styles. And so, a lot of it is self-study, but the professors are always available, and I did always find that I learned in lecture and in class. The anatomy lab that we have in the first semester with the human cadavers was a great experience, and you know, getting to learn anatomy that way for me was wonderful. I'm a visual learner and a kinetic learner, so I found that that was really helpful, and you're paired up with just a couple other classmates and teaching each other and kind of going through the anatomy that way. It not only builds your friendships in your first semester, but it really helps you learn and consolidate all of the things that you're learning in class. So that's really was a great experience. The professors are always available. They live on the island. There's not, it's a small island, so they're always around in their offices and things like that if you would need any help, or they're always available. And with a small class size, you can always find time to meet with your professors. So I'm just going through some other questions that I have. In terms of the island, it's a wonderful, peaceful little island. It's very small, 5 square miles. And although it's not necessarily known for its beaches, it does have a beach, and the climate is really beautiful. There's beautiful hiking, and a lot of people go scuba diving and we've done snorkeling. The people there are so friendly, and it's really, I think, the only place that I've ever been where I have hitchhiked every single day that I lived there almost. It's very safe. The people are very friendly. I think I said that now like 3 times. And over the course of my time there, you really meet almost everybody, it seems, on the island. And when you see them, you can greet them by name, and they will always, greet you kindly. So that was really nice. And that makes being in a stressful time a lot easier. Sometimes, you can't avoid all the stress and things like that will come with medical school, but being around people who, are friendly, and that will be your classmates who are supportive, but also just the local people are so kind, and you'll get to know them. So that's really wonderful, and it makes it a little bit easier. Let's see. In terms of preparation for the steps, so the USMLE steps are certainly the most important exams that you take that determine your fate of a residency and your residency match success. And I feel that the curriculum at Saba did prepare me very well. One of the most important reasons, I think, is that the schedule and the academic schedule, that the way it is that you have exams every 3 weeks. When you're studying, if you really focus on learning everything really properly for the first time, then by your finals, you're just reviewing. And by the time you take your USMLE, again, you're just reviewing, and all that knowledge is consolidated every time you review it. But that for me really prepared me, being in that study pattern, knowing that you didn't have a chance to revisit it later, which was a study habit that maybe a lot of people have in college, that you'll just study it for the final. You're really studying it every day, and so by the time the final comes and by the time your steps come, you're very prepared. Someone asked about attrition rate. I don't know that I can really comment on that personally. I'm sure that the deans can comment on that, and you can probably find that information online. My class did have a significant retention. We did not have many people that dropped out, but I'm sure that varies a little bit, and I don't think that I'm maybe the most appropriate person to comment on that. They do set a pass rate. When I was there, it was 70%, and I think that is to your benefit and to our benefit, because if you think about every test, if you're getting more than 30% of the questions wrong, you maybe need to review that. So just keeping in mind that you want to get as close or as high a mark that you can possibly get, and you want to know as much, then I think that is the right way to approach every exam, and you don't have to worry about attrition. So back to step one. So again, keeping that in mind, trying to do your best on every single test. That is what helped me be successful in my step one. When I left the island, we used similar study resources and a similar study schedule that we had developed on the island. And myself and two of my classmates decided to get an apartment together for a month, and we studied together every day, and that really helped just kind of keep each other motivated and keep each other kind of moving forward and not falling behind, and relaxing, since we were now moved home and there's so many distractions. So doing that and using the same, again, study techniques that we were doing on the island, in addition to additional question banks and things like that, we were all very happy and very successful. Someone asked what my mark was previously, and I, on my USMLE Step 1, scored a 250. So that was, for me, that was a score I was happy with, and was able to make me competitive for when residency application came. At the time of my clinical rotations, I started my rotation with surgery. After all of getting my RLRA done, the paper, and getting things in order to start clinicals, that was the rotation that fit the best for me, that I could start the earliest. So I did start with that, and it was at the hospital where I'm now matched, at St. Mary's Hospital. Hi, Barbara. Barbara was my landlord when I was on Saba, and we still chat to this day. So really wonderful friendships that you make when you're on the island. But anyhow, so my first rotation was in surgery. It's at the hospital where I'm at now. There are a lot of things that you learn in clinical that you can't really prepare for, but I did feel that I was prepared for clinicals, that the knowledge that I had from the basic sciences really carried over, and that the hard work and kind of the responsibility and the accountability that Saba forces you to take when you're on the island, if you bring that over to your clinicals and just remember that, you're responsible for your own learning, and, everything that you do, kind of people are watching, and you need to just kind of take that with everything, take that sense of responsibility, then that really shows. And I found that although I started with surgery in my first rotation, and many other students were in their last rotation, or in, midway through, that there wasn't a difference. And I think, if anything, the students that, knew me said they couldn't tell it was my first rotation, because you kind of bring over that responsibility. And now, as a resident, when I see students and things like that, that's the first thing that we notice about medical students when they rotate is, their appropriateness and their responsibility, their demeanor. And those are all things that I think, just because you've gone through all of this to get to where you are, all of the sacrifices and the hard work that you've put in, you have to take it seriously. And I think it shows after you've been through everything. So that was one of my favorite rotations, although I didn't really realize it at the time. During my surgery core, I just kind of was going through the motions, in and day out, rotating on the service, going to the OR, and doing whatever else the residents needed to do. And I didn't necessarily know that it was what I wanted to do. I actually wanted to do pediatrics and maybe pediatrics oncology. But after I went on to do medicine, I realized that there was no way I could do anything other than surgery. So I did the rest of my clinicals. I finished my third-year clinicals, all the required, and then I did electives in surgery. I did electives in breast surgery, first at Rochester General Hospital, which was a great experience, and I also did a breast rotation in breast surgery at St. Mary's, and I did my surgical sub-internship. And I did a surgical critical care rotation as well. So all of those rotations really helped consolidate my decision to continue with surgery residency. And I had it was very easy for me to book my electives with the clinical coordinator at the time, and there was really no issues with that. So I was very happy to do that. And I got the ones that I want very early. I booked them as soon as I kind of knew that I wanted them, which was during my third year. I booked them for my fourth year, and it was very smooth. In terms of medical electives that I did the majority at Rochester General Hospital. That hospital is like 2 hours for where I grew up, so that was perfect to be close to home. And I did my electives in infectious disease, radiology, and there was another medical one that I don't remember. Tulsi, I'll answer some more questions at the end, if that's okay. So that way I'm going chronologically kind of through the events. So during clinicals, we also take our step 2, and having really done a lot of self-study by this point on the island and for the step 1, I think that you really learn what works for you and what doesn't. Everyone's a little bit different, and a lot of my friends had different study habits that you know, we tried to pick up little things from each other to do better, but, you know, ultimately through trial and error, we just found things that worked the best for us, and they were not exactly the same for every one of us. So, again, for step 2 now, having done this several times, I took off only 4 weeks this time, having, you know, done it several times before and having studied all through clerkships, because again, the shelf exams that you have throughout your clerkship, if you study and really prepare for those and score well for those, I think in anything that you do the second time, or, you know, everything is repetition. So when you're doing them again, it just goes really fast. So, again, that exam went well. I was happy with how it did. I scored on that exam a 259, and that score was submitted to my residency applications. There were some questions about the match. So I did match on my first year of applying, and I was a September class, so it was pretty tough to get everything. Well, everything worked out well that it got in time, but there are sometimes cases where people need to take a little bit longer, but I was very fortunate, and everything went well. I matched in I'm seeing the questions come up here. I matched in a program that I'm very happy in. As I mentioned, it's where I kind of started my clinical rotations. So the people there are very special to me. And my program director was my first clinical director, who encouraged me to consider surgery when I said I wanted to be a pediatric oncologist. And I didn't really know what that meant, but I thought I wanted to work with kids who had cancer, and I wanted to, you know, save them because they have a high survival rate for certain kinds of leukemias. And then, you know, after, it really didn't take much for me to decide I wanted to do surgery. The resident who was an intern on my first day, when we kind of started together at the same time when I was a third-year medical student, she'll be my chief next year. So that's really a special place for me. And, you know, I got to rotate there because it was a Saba affiliated hospital. So that makes me really happy. There's some other questions about what my day-to-day life is like now as a resident in surgery. That changes kind of day-to-day based on your service, or month-to-month, depending on how you know, your program is. And for me, it changes almost every year, just because of the responsibilities that you have. So in my first year, you know, my day was very long. Your morning started around 4:30 in the morning, sometimes 5, pre-rounding on all the patients, and then rounding with your senior, going either to the OR or, you know, going to do all the tasks that were asked of you for the day, rounding again in the evening, and all of that before you could sign out and go home. Clinic sometimes in there as well, and procedures and things like that. In our second year, we do a lot of ICU care. The day is similar. Your clinical duties, start early. They end whenever the patient care is done, although there's, duty hour restrictions across the country. So you do have to go home. And this year, my schedule is very different because I'm on my research year. So certain general surgery programs have incorporated full-time research years or research scholarships where you will either stay at your institution or go to another institution to conduct research that makes you kind of a more competitive fellowship applicant, or it's just good experience. And so since the beginning of July this year, I've been doing my research year at the University of Massachusetts, and we're doing various projects investigating disparities in the treatment of patients with emergency surgical problems based on their insurance type. We're also doing some more basic science research investigating anticoagulation in hibernating black bears in parts of northern Michigan, and that is basically, the question is, how do these bears stay anticoagulated in the winter when they're obese, they are immobile, and their basal metabolic rate and temperature goes down, which happens to a lot of our surgical patients. And if we can figure out why the bears aren't clotting, then we can develop new therapies for prevention or treatment of DVT in post-surgical patients and critical care patients. So that's part of the research that I'm doing. And it's definitely a different change. I mean, in your research, you are now working with normal, non-clinical people. So your day might start at 8 or at 9, but you're always doing stuff at home too. So it doesn't necessarily end when you come home. You're always reading, writing grants, things like that, looking for new grant opportunities and new conferences to submit to and things like that. So it's definitely a different workflow. We still take call at the hospital during that time, so you're not totally out of clinicals, which is really good, because a whole year without touching a patient or seeing a patient, being in an OR, is a long time. So we still take call, which is like good to have your feet in both doors. And then in this July, I'll go back to full-time clinicals, and my schedule will be more like I had mentioned before. And then I was asked to speak a little bit about some of my volunteer interests. So I have a big interest in global surgery, and ultimately that's how I want to kind of spend some of my focus and research in the future, and what I'm kind of trying to do now as well, and spend some more of my volunteer time. It was a big reason why I recently decided that I'll pursue a fellowship in plastic surgery once I've completed my general surgery residency. In plastic surgery, there's just a large number of people who have an interest in global surgery, and that kind of drew me to that, like attracts like, right? So for me to go into surgery first, I realized I was similar to the people in surgery. We have similar work habits, similar values. We behave the same. We like to be up early. We like to get things done. We don't like to sit. And then, learning about plastics and how there's a large proportion of people who are interested in global surgery, like I mentioned, that drew me to that. So global surgery is particularly important in plastic surgery because a lot of these reconstructive problems, there's a lack of surgeons that can perform the procedures. And also there's obviously difficulties with access when in a lot of low and middle income countries, people, are dispersed to rural areas. And even if there are medical professionals and surgeons who can perform the procedures, they may just not have the means to get to them. So I was very fortunate last year to participate in a surgical mission with a group called Amana, and we went on a Save Smile mission. It was their 9th one last year. They're getting ready to go on their 10th one this week. And we went to Khartoum in Sudan, and we were able to, as a team of about 25 people, repair 200 or so cleft lips for young children and as well as adult patients. And so this is an interest of mine. I mean, plastics is an interest of mine as it kind of addresses so many different problems, whether they be due to disfiguring cancers, trauma, congenital deformities, you know, and the approach that you have to take to repair them is individualized for each patient. So it draws unique challenges each time. And they have to be catered to the patient in order to give them, you know, the best, not only cosmetic outcome, that's only one part of it, but really it's functional, the best functional outcome. And ultimately that affects their quality of life. So I was involved with that project because one of the plastic surgeons who has been going since they started going 10 years ago, he was a graduate of my residency program. So my residency program director hooked me up with him, and we met and talked, and he was wonderful, invited me to go along. So that's how I got involved with them. There are different ways that people in surgical residency can get involved. It depends, I guess, on what your interest is. You know, even research, there's a lot of people doing research in global surgery, and that's really meaningful and important as well. And I guess it just depends what you're looking for. And the important thing is to remember that, you know, when you are going or doing something, just remember the people that are there, and that, you know, ultimately a sustainable mission where there's some component of education and where you're using the people that are there as well as collaborators is probably the best kind. So that is just my 2 cents on that. And then I'm getting to the end of these questions, I think. So what would I tell students that are currently looking at Saba? So I think that if I were talking to myself, how many years ago would it have been now? I started in 2012, so 7 years ago, I would tell myself to do it, and not to be nervous, not to be worried. And if you move forward, just kind of don't look back. You are going to be successful if you put in the time. And I think that I had a wonderful experience at Saba. I had everything that I needed. And, you know, the only thing that you need to do is put in your time and your hard work, and you'll be successful. I don't have any other thoughts at the moment. If I think of anything in the next couple minutes, I will add, but I'll go back to see some of the questions here. So Tulsi asked, when did I start studying first aid in U.World? So if I recall correctly, while we are in our last semester on the island, we have a class that kind of helps you start to study for the step 1. And before going for my last semester, I think what a lot of us did is we bought the first aid textbook and we brought it with us to the island so we could use it while we were on the island for that last semester. I think U.World, we also started at that time. It's hard for me to remember exactly if I started at that time or when we were done our exit exam, which is the exam you have to write at the end. I know that we did practice exits on the island that you can buy, the NBMEs. I don't remember if we started U.World before, but you really start studying very hard for it when you're done, because while you're on the island, you still have course requirements, but you're kind of studying for it the whole time as well. So having that first aid book early, I mean, I'm someone that's all about repetition and different forms of studying. So, seeing that book multiple times, reading the pages over and over again was helpful for me. People would often comment that my textbooks are coloring books because they're just filled with highlighter and pen. what other materials did we use to study? So I think going back to that, that's just really predominantly was the first aid, the U-World, the NBME shelf exams practice that you can buy. We definitely did some of those, and that was helpful. And then there was also some prep videos that we had, and I can't remember the name now of it's been so long, I can't remember the name of the course, but there's some video lectures, and that's one thing that I still do to this day, is I still use several different forms of media or text to study. So I still use video lectures and for studying for my surgery exams. So, it's not, it will never be harmed for using fewer things or more things to study. I don't think. I think it always helps. Dr. Robinson. I had Dr. Robinson. She was, I think, we were there when she did her first semester teaching with us in infectious disease. And yes, it's really cool that we get to do some research now. I'm really happy to have that opportunity. It does prolong your residency training, like by a year or two, depending on how many years of research you do, but it's really interesting. Yeah. Okay. The research, the RLRA project, so the independent research project that we do, it gives you something to talk. Actually, the best part about it is it gives you something to talk about in your interviews. They may ask you what kind of research that you've done, and you need to have something to talk about. And I did mine on resiliency in children with acute lymphoblastic leukemia, I think. A lot of the research was qualitative, but I did a systematic review on that, essentially. And that's because I thought I wanted to do pediatric oncology. So from what I recall, there was a list of topics that were very good topics, very interesting and very appropriate. Now that I think back, now that I had the experience that I have in research, I think back to those topics, and probably picking one of the existing ones that was listed would have been a good idea. But I came up with something that was, that I thought of, or sort of, or that wasn't on the list because I wanted to investigate that. And you choose a mentor, and mine was Dr. Dumitrescu. And so that person goes back and forth with you, discussing how you will formulate your research question and how you will basically write your paper. And then when you submit that, it has to be approved by the committee. They may have some feedback for you and things they want you to edit, and then you can submit it again, etc. And once that's done, you can go on to your clinicals. Again, it's only one project, and again, I think it was helpful to talk about, and it's something that a lot of the American students, they're doing research all the time. Now that I'm in research here, they ask me if they can do a project with me, and we're like available to them, and they try and get themselves on these projects. So I think that it's really important that we have something too, and the school gives you kind of a dedicated time to do it, so you're not doing it in clinicals, you're doing it before that, because when you get started, it's just so hard to find time. So I think that is helpful. Is it Lucturio? I don't really know what that means, Tulsi, but I'm just going to check if there's any more questions, and if not, thanks for everyone who is tuning in. If you have any other questions that you didn't get to ask, you can feel free to reach out to the school or to me, and I'm happy to answer. And I hope that you have the best of luck in your studies and your future careers. Thank you.